Health leaders have said repeatedly, if you are vaccinated, coronavirus is a preventable disease. If you are a person of color who won't or can't get the vaccine, experts say you are putting your life at risk.
If you age adjust the data, what we're seeing is that Black folks have gotten sicker at much higher rates and have been hospitalized at much higher rates.
Dr. Bakosi Dubey, Senior Health Advisor for the Oregon Health Authority, says public health emergencies force us to open our eyes to society's disparities because despite any beliefs or opinions, the data does not lie. At one point, Black people were hospitalized for COVID infections at more than 5 times the rate of white people in the Portland metro, while making up less than 6% of the population. Portland's Latinx community faces similar disparities. So where are we now? More than half of the state's BIPOC community is vaccinated, but it is not enough. In the race to beat COVID and finally end this pandemic, health leaders are sprinting to find ways to break down barriers and hear people's concerns and save lives.
Oh, they absolutely are. Peace Health here has told me that they have had to divert their ambulances more often than they ever have before. They're not the only ones feeling that, though. We also spoke with LifeFlight. They say they're flying more often and further away. This is a sound you may hear more of. LifeFlight handles medical transports by air for Oregon, Washington, Idaho, and Montana hospitals. They say with the Delta variant ravaging our communities, they are flying more than ever.
As hospitals near or at capacity, especially the rural facilities, they depend on air medical and ground ambulance to transport their patients to tertiary centers.
But as we know, even our main hospitals are reaching their limits due to the unvaccinated COVID patients. And as that happens, LifeFlight Regional Vice President Michael Weimer says they are turning to other facilities.
It means that those facilities may need to transport patients to a hospital they normally don't refer to, which are often out of state. That increases the burden on the transport method.
That can sometimes send a LifeFlight crew on a 6 or 7 hour trip, meaning they have to pivot.
As patients are transported greater distances, meaning the assets are out of the area longer. So there's a need to backfill to ensure that there's adequate coverage in those areas.
So on top of making sure that there's adequate coverage, Weimer says those longer trips also put more added stress on their crews, just like nurses and doctors. He tells us that the LifeFlight transport teams are feeling the stress of COVID-19. Luckily for them, at this point, they are not facing any shortages.
And they'll tell you that those numbers say that vaccinations and masks do the job at keeping COVID cases down. Now, the stricter mask mandates that Oregon is looking at, well, they say it can take about a month for those to make a difference, but not getting a shot, that seems to be the big difference for Southern Oregon.
You can get his arm like under his foot a little.
Hospitals in Southwest Oregon just flat out don't have room for all the COVID patients, most brought in by the Delta variant.
We're seeing more ill patients. We're also seeing younger patients. This time, as compared to last time, we're seeing more staff that are affected by it. I have anywhere from 50 to 70 staff out at a given day right now. So at the same time, I have a huge surge of patients. I'm limited on staff.
Dr. Jason Gray says his staff who got the virus didn't get it at work, but out in the public. Take a look at this comparison. In Jackson County, there were 614 COVID cases reported Tuesday. That's out of about 220,000 people in the county, with just 52% of the residents vaccinated. On that same day in Multnomah County, less than half as many cases, a population nearly 4 times the size, but more than 70% vaccinated. Professor Brett Tyler has tracked the COVID-19 virus mainly through testing wastewater.
So it's really, really important to break the chain of transmission.
His lab caught the Delta virus early on in Eastern Oregon before it showed up in the clinical testing and warned that it would spread, which it did. And now we're seeing it quickly rise up in Southwest Oregon.
Yeah, it's actually everywhere. Latest wastewater testing shows it's in every single community in Oregon, and in most of those communities, it's the only variant present.
And you've heard a lot about how the Delta variant is more contagious, how even people who are vaccinated can get it and spread it. Well, one researcher we talked to today says there's a lot of misinformation being spread about that. We'll have more on that tonight on K2 News.
Yeah, Steve, there are a number of precautions in place. We're here on the southeast East Bank Esplanade. This is where one of the major exchanges will be. And one of the changes that runners will notice is that the second that they step off of the course, well, they're going to have to put their mask right on. Participants are going to be required to wear a mask at the start, finish, and at all the exchanges.
Is this kind of event safe? Is it a super spreader event?
In general, the is it safe question is sort of a yes or no. I think it's a question of risk.
Dr. Jennifer Vines is much less concerned about outdoor races like Hood to Coast than indoor events.
If you're outdoors, that's great. From a COVID risk reduction standpoint, that's one of the best things that people can do.
2, 1. Usually for Hood to Coast, about 30 people take off in waves 15 minutes apart. This year, the start line will be cut in more than half, with heats every 5 minutes.
Does that have a significant impact as far as risk?
Totally. So the more space people have, just the fewer opportunities there are for bottlenecks and crowding in any kind of large gathering or large event are only going to help reduce risk.
But the risk isn't zero, especially with the highly contagious Delta variant in play. Dr. Bukosi Dube says the best thing is to avoid large gatherings.
When you have large numbers of people gathered like that, then it is going to spread in that environment.
Now, both doctors agree the mitigation strategies in effect, including masking and social distancing, can help reduce the transmission of COVID-19. Hood to Coast is different than other major races in that it's a relay, so people start at different times. Coming up on K2 News at 5 o'clock in an hour, we'll let you know we heard from the Portland Marathon today. That event is just about a month out.